Have you ever felt your heart race without knowing why, or avoided a situation simply because the fear felt too overwhelming? In the previous video, we introduced psychological disorders and explained what abnormal behavior really means. This is part 2, and today we move deeper into major psychological disorders, beginning with one of the most common and misunderstood categories: anxiety disorders. Anxiety is a normal human emotion. Feeling nervous before an exam, worried about the future, or alert in a dangerous situation is completely natural. However, when anxiety becomes excessive, persistent, and uncontrollable and starts interfering with daily life, it may be classified as an anxiety disorder. Anxiety disorders are a group of psychological disorders categorized by intense fear, excessive worry, and heightened physiological arousal, even when there is little or no real threat. Unlike normal anxiety, anxiety disorders last for long periods, feel out of proportion to the situation, are difficult to control, and significantly affect thinking, emotions, behavior, and physical health. People with anxiety disorders are not weak or overreacting. Their nervous system often remains in a constant state of high alert, as if danger is always present. Common symptoms of anxiety disorders. Psychological symptoms include excessive worry, racing thoughts, fear of worst-case scenarios, and difficulty concentrating. Physical symptoms include rapid heartbeat, shortness of breath, sweating, trembling, muscle tension, stomach discomfort, and fatigue. Behavioral symptoms include avoidance of situations, restlessness, sleep disturbances, and a constant need for reassurance. Major types of anxiety disorders. Generalized anxiety disorder involves chronic and excessive worry about everyday matters such as health, work, family, or finances. The worry is persistent, difficult to control, and present most days for at least 6 months. Panic disorder is marked by sudden and intense panic attacks. These attacks may include chest pain, dizziness, breathlessness, and fear of losing control or dying. The unpredictability of panic attacks often creates a fear of future attacks. Phobic disorders involves intense and irrational fears of specific objects or situations. The fear is immediate, excessive, and leads to active avoidance even when the person knows the fear is unreasonable. Social anxiety disorder involves a strong and persistent fear of social situations, where one may be judged, embarrassed, or humiliated. Now let us understand what is phobia. A phobia is an intense, irrational, and persistent fear of a specific object, situation, or activity that poses little or no actual danger. What makes a phobia is that the fear is excessive, out of proportion to the real threat, difficult to control, and disruptive to daily life. When a person encounters the feared object or even anticipates it, the body responds as if facing real danger. Types of phobias. Specific phobias involve fear of particular objects or situations, such as animals, heights, storms, flying, elevators, blood, or injections. Individuals may avoid careers, travel, or medical care because of these fears. Agoraphobia involves fear of situations, where escape might be difficult or help may not be available. This may include crowded places, public transport, open spaces, or being outside alone. It often develops after repeated panic attacks. Causes of phobias. Phobias may develop due to traumatic experiences, learned fear from observing others, biological preparedness to fear certain stimuli, and genetic vulnerability. Avoidance strengthens phobias because it prevents the individual from learning that the feared object or situation is not truly dangerous. Now, let us understand what is social anxiety disorder. Social anxiety disorder is a persistent fear of social or performance situations in which a person may be evaluated by others. The core fear is social anxiety is the belief that others are watching, judging, and waiting for mistakes. The fear is not simply shyness, it is intense, long-lasting, and emotionally distressing. Common triggers of social anxiety: public speaking, answering questions in class, meeting new people, eating or writing in front of others, job interviews, and social gatherings commonly trigger social anxiety. Symptoms of social anxiety. Emotional and cognitive symptoms include intense fear before social situations, overthinking interactions, fear of rejection, and harsh self-criticism. Physical symptoms include blushing, sweating, trembling, rapid heartbeat, nausea, and dry mouth. Behavioral symptoms include avoidance of social situations, minimal speaking, reliance on distractions, and leaving situations early. Impact and treatment. Social anxiety disorder can affect academic performance, career growth, relationships, and self-esteem. It is highly treatable through cognitive behavioral therapy, exposure therapy, social skills training, supportive counseling, and in some cases, medication. Anxiety disorders show us how fear can become persistent and overwhelming, shaping thoughts, behavior, and everyday life. Understanding these disorders is the first step towards reducing stigma and promoting mental well-being. Students, now let us understand obsessive compulsive disorder, which is also known as OCD. It is a psychological disorder categorized by obsessions and compulsions. Obsessions are recurrent, intrusive, and unwanted thoughts, images, or urges that cause intense anxiety or distress. These thoughts are not simply excessive worries, they feel uncontrollable and disturbing to the person. Common obsessions include fears of contamination, doubts about safety, intrusive, aggressive, or religious thoughts, and an intense need for symmetry or order. Compulsions are repetitive behaviors or mental acts that a person feels driven to perform in order to reduce anxiety caused by obsessions. These behaviors are not performed for pleasure but to temporarily relieve distress. Common compulsions include excessive hand washing, repeated checking, counting, arranging objects, or repeating words silently. The key feature of OCD is that the relief provided by compulsions is short-lived, which strengthens the cycle of obsessions and compulsion. People with OCD usually recognize that their thoughts and behaviors are irrational, yet they feel unable to stop them. OCD can be time-consuming and significantly interfere with daily functioning, relationships, and work for academic performance. Post-traumatic stress disorder or PTSD. PTSD develops after a person experiences or witnesses a traumatic event that involves actual or threatened death, serious injury, or sexual violence. Traumatic events may include natural disasters, accidents, war, assault, abuse, or witnessing death or severe harm. PTSD is not a sign of weakness, it is the mind's response to overwhelming stress that exceeds a person's ability to cope. The core feature of PTSD is the persistent re-experiencing of the traumatic event. This may occur through flashbacks, nightmares, intrusive memories, or intense emotional distress when reminded of the trauma. Another major feature is avoidance. Individuals may avoid places, people, conversations, or activities that remind them of the traumatic event. PTSD also involves negative changes in thoughts and mood, such as emotional numbness, guilt, fear, loss of interest in activities, and difficulty experiencing positive emotions. In addition, there is heightened arousal and reactivity, including irritability, hypervigilance, exaggerated startle response, difficulty sleeping, and problems concentrating. These symptoms last for more than 1 month and significantly impair daily functioning. Somatoform disorders. Somatoform disorders are psychological disorders in which a person experiences physical symptoms that cannot be fully explained by a medical condition. The symptoms are real and distressing, but their origin is primarily psychological rather than physical. Individuals with somatoform disorders are not pretending or faking illness. Their distress is genuine and the body expresses psychological conflict through physical symptoms. These disorders highlight the strong connection between the mind and the body. Types of somatoform disorders. Somatization disorder. Somatization disorder involves the presence of multiple recurrent physical complaints affecting different body systems over a long period of time. Symptoms may include pain, gastrointestinal problems, sexual symptoms, and neurological complaints. The symptoms begin early in life and lead to frequent medical visits, yet no adequate medical explanation is found. The individual often believes they are seriously ill despite repeated reassurance from doctors. Conversion disorder. Conversion disorder involves neurological symptoms that cannot be explained by medical examination. These symptoms may include paralysis, blindness, deafness, loss of sensation, or seizures. The symptoms often appear suddenly after psychological stress or trauma. In conversion disorder, emotional conflict is unconsciously converted into physical symptoms, allowing the individual to avoid psychological distress. Pain disorder. Pain disorder is categorized by severe and persistent pain that cannot be fully explained by physical findings. Psychological factors play a major role in the onset, intensity, or maintenance of the pain. The pain causes significant distress and interferes with daily functioning, work, and relationships. Hypochondriasis. Hypochondriasis is categorized by a persistent fear or belief that one has a serious medical illness. Despite little or no medical evidence, individuals misinterpret normal bodily sensations as signs of severe disease. Even repeated medical tests and reassurance fail to reduce their anxiety. The focus is not on the symptom itself but on the fear of having a life-threatening illness. OCD shows us how intrusive thoughts and repetitive behaviors can trap the mind in a cycle of anxiety. PTSD reveals how deeply trauma can affect memory, emotions, and behavior. Somatoform disorders demonstrate how psychological distress can express itself through physical symptoms. Together, these disorders remind us that mental health is not separate from physical health, and understanding them is essential for empathy, diagnosis, and effective treatment. Students, this is part 2 of your chapter. Please watch part 3 to understand the remaining psychological disorders.